The healthier people usually have more money because they're not spending it on healthcare. But it could go the other way. They could be spending it on cruises and trips and having fun. So, I think it's important when you talk about retirement planning, sitting down and looking at, what your healthcare picture looks like. And because as we get older, we all know, illnesses take place and injuries, and our body just can't keep up like it used to when we were your age, Jim. But anyway, so one of the things, when we're getting into this in this segment, we talked about Medicare, and I talked a lot about Medicare Advantage, and I want to go back a little bit on original Medicare with a supplement. Supplement coverage. They standardized supplements back in 1992. And basically what that means to people out there is if you decide you want to go to original Medicare and stay with original Medicare and buy a supplement to cover the gaps, then what you have to do is you basically have to shop the different plans that are available. And I'm going to give an example of what's called a Plan G, as in G as in girl. That's pretty much a comprehensive supplement today. You have to pay a Part B deductible, which is under $300. And after that, pretty much everything Medicare covers, the Plan G picks up the gaps. So when you're looking at a Medicare supplement in original Medicare, what you have to keep in mind is it's private insurance companies. So insurance companies are out there to make money. We all know that. But a Plan G is a Plan G no matter what the company. They have to abide by the Medicare regulations. So if I'm comparing companies and prices, and a lot of times we find this, people be paying, $50, $60, $70 more per month for the exact same coverage that they could get with another company. Now, what they have to be careful about, and this is real important in retirement, depending on our health, is if, they want to switch companies, they have to answer some health questions. Now, they're not going to make you run a treadmill and give blood. There really are black and white questions, yes and no questions. They go back a couple years looking at the major illnesses or if you've had surgeries or anything coming up in the future. But if you can answer no to the questions, then you can switch your insurance. Just like if you bought car insurance and you had a good driving record and you want to switch your car insurance. So it behooves people in retirement, especially talking about longevity. I just helped a gentleman down in South Florida who was 93 years old switch a supplement, and he got approved, and it saved him almost $58 a month for the exact same coverage. And he's like, Steve, do you think I can get approved? I said, well, let's go through the health questions. So it really is that easy. And that's being wise with your money, especially if you're going to live longer. I don't know about you, Jim, but nobody else, I don't want to pay more for insurance than I have to. So that's one of the ways we can help. Is looking at those Medicare supplements, picking out a Medigap plan, and making sure they keep up with them year after year.